we've had instances where people go for honeymoon, and when they come back, that marriage ends there, okay? Which is very sad.
Very sad.
What has happened? Because of this frequent and aggressive sexual activity that took place during the honeymoon, there is a possibility of not only even E. coli, even other bacteria being transferred from the vaginal canal to the urethra, okay, from the perineum to the urethra. Are you seeing? So that activity may end up causing cystitis. Cystitis is the inflammation of the bladder. And remember we said even infection of the bladder is part and parcel of the UTI.
Yes.
What is these signs and symptoms will you have so that you can be able to know that you have urinary tract infections?
Urinary tract infections, sexually transmitted illnesses or infections. What is the difference, you may ask? And that is our topic today. We are going to look at UTIs, and we are going to know how are they affecting our lives. On this show, we talk about our health, and Health Now Show as your friend. There has been a lot of confusion between UTIs or urinary tract infections and sexually transmitted infections or diseases. And some of them have caused a lot of tension and conflicts in the families because of not differentiating the two. They are so distinct, they are so separate, but somehow they present in a way that may confuse us. And that is why I am so delighted today to have our guest. She's not entirely new to us. You met her in our previous episodes. But today she has a different topic. She's going to talk about UTI specifically. But she'll tell us something about STIs. And this is none other than clinician Josephine. She's going to introduce herself to most of us that may not have interacted with her on this show. And then we are going to pick it from there and roll on until we get to understand the differences. And we see how can we avoid UTIs in our lives. So, karibu sana Josephine. Thank you so much.
Thank you
for gracing this session, yes, and even finding time to come and be with us.
So thank you very much, Madam Jane, for hosting me. You already said my name, but maybe I can add on to what you've said. Yeah, my name is Josephine, and I'm a clinician by profession. I'm also a forensic expert. At the same time, I'm also a lecturer in one of the universities in this country. And as Madam Jane has said, today we would want to look at urinary tract infection, and she preempted that we would really want to know the difference that exists between urinary tract infections and sexually transmitted infections, illness or disease. All those terms would mean the same, so that we can be able to understand the difference, and we can be able to address the challenges that arises from confusing the two. So to begin with, maybe I can begin by saying, why do we need to know about UTI? First and foremost, we need to know that yes, it's a disease that can catch up with everybody, and everybody means children, women, and men, but it is more common among women. And in this forum, we shall be able to understand why is it more common among women. than they are in men, or why are they more common among girl child as compared to boy child? We'll be able to understand in this forum. At the same time, now that I have said it is more common among women or the girl child, it is important to know that from the statistics, they say that at least one woman in 5 women in their lifespan or in their lifetime, they have to suffer urinary tract infections. So what is urinary tract infections? Urinary tract infection is basically infections in those organs that forms the urinary tract. These organs includes, it can be infection in the urethra, yeah, that is that a pipe, can we call it pipe, or that path that urine passes through from the bladder to the outside. That is what we call a urethra. It can be also includes the infection of the bladder as well as the infection of the kidney. All those areas, once they are affected by a disease, that's the time we talk of urinary tract infection, and that is what we shall be looking at today.
Wow, quite a mouthful, and very, very welcome.
Thank you.
Now, probably you can start by defining or explaining further, what are the UTIs, if we could simply use the initials, the UTIs.
Okay, let me come over it again so that it sinks very well. Urinary tract infection. It is the infections that will attack the urinary tract. And I have said urinary tract basically is from where the urine is, we say synthesized or manufactured to the outlet part.
Okay.
That is the urinary tract. So it mainly involves the kidney. Of course, there is the ureters. Ureters is the pipes that are there in between the kidney and the bladder.
Yes.
There is the bladder, then there is the outer pipe, which is the urethra that now takes out urine.
Yes.
So any infection anywhere there, that is what we call urinary tract infection. Yes.
What are these causes?
All right.
What causes it?
Urinary tract infection has very many causes, and we shall highlight some of them today so that we can bring ourselves to the know-how of what really causes it. So first and foremost, we begin with that which is the commonest cause. Okay, that which is the commonest cause is actually a bacterial infection. But before I talk of those causes of urinary tract infection, I would want to say that infection will get into the urinary tract. It can get there in 2 ways.
Okay.
It can get in through what we call them port of entry.
Okay.
It can get in there through the ascending way or the ascending path, or it can be hematogenous through the blood.
Okay.
So first of all, we need to understand that, so that even when you're talking about bacterial infection being one of the causes, then we know then this bacteria has to use either of those 2 parts to get to the urinary tract.
Yeah.
So then now when we come to the causes, we start with the commonest and the main cause, which is bacteria. It is a bacteria we call Escherichia coli, or in shortcast, E. coli. Just call it E. coli.
E. coli.
That is, yes, that is a shortcut and easy to pronounce.
Okay.
It is a bacteria that is commonly, or it is the common bacteria that causes the urinary tract infection. They actually say some literatures will talk of 85%, others 90%, others will cite 95% as being the cause of the urinary tract infection. So what is so unique with this bacteria? This bacteria is actually, it's one of the so-called normal flora bacteria, the bacteria that lives with a human being normally, but it's a bacteria that lives at the rectum or the GIT. There it does not cause so much havoc unless you bring in foreign Yeah, you bring in foreign E. coli, maybe from eating contaminated food or something. You put excess of the same to the gut such that it brings a problem there. Otherwise, when it is there, it has its role, it has no problem.
That is its home.
That is its home. But the moment it leaves its home and gets to the urinary tract, it goes to cause havoc there.
Elsewhere.
Yes.
Ikitembea kwa mwenyewe, kwa neighbors.
Yes. Once it goes to the neighbors, it goes to cause havoc. So this E. coli that is so much at home in the rectum, the moment it gets, or other parts of the GIT, the moment it gets into the urinary tract, it causes urinary tract infection. So that's one. So the other question will be, then how does it get there? Okay. Why we still come back and say women are the ones who are more vulnerable to getting UTI, it's because of our anatomy as women, or the anatomy of women, the structure, maumbile ya mwanamke. You find that the anal region and the urethra, they are very close. Yeah, they are very close as when you compare between the urethra of a man and the anal part of a man. That's why that anatomy alone makes it very easy for this bacteria to travel to this other side. That said and done, there are other factors, or there are other causes that can at one point either help these bacteria to get in there, or there are also other factors. I mean, there are also other causes. So while we are still at that bacteria, we would want to say, for example, a sexual activity. At times can also act as a driver, or a vehicle to take that bacteria in the urethra, because we've talked of the anatomy.
Yes.
That's why you realize at times a sexual activity can also be blamed for it. But mark you, we are not saying UTI is STI. I want you to mark that. It's only that here.
Note.
Yes, please note. It's only that here during the sexual activity, especially when there's some compromise of hygiene, but not always, this E. coli could be somewhere in the perineum, okay? And it may get...
Perineum is...
the area between the anal region and the vaginal canal. Okay. So it may get taken, it may be transferred to the urethra with ease. So that is one. Okay, but we also have other factors, and this is where maybe I may bring in a new term, that maybe people may associate it with what they know, but I want to associate it with health. Okay, this is what we call honeymoon UTI. Okay. Honeymoon UTI, we've had instances where people go for honeymoon, and when they come back, that marriage ends there, okay? Which is very sad. Very sad. What has happened? Because of this frequent and aggressive sexual activity that took place during the honeymoon, there is a possibility of not only even E. coli, even other bacteria being transferred from the vaginal canal to the urethra, okay, from the perineum to the urethra. Are you seeing? So that activity may end up causing cystitis. Cystitis is the inflammation of the bladder. And remember we said even infection of the bladder is part and parcel of the UTI. Yes. Okay? Yes. It's in the umbrella of UTI. So we say there is the honeymoon UTI that is very common with people after honeymoon, and the blame is always on the man. When we were going to the honeymoon, I was not having this and this, and now we are coming back, I'm having this. So that means even before we married, you're not faithful and the like. So people need to know there is something like honeymoon UTI. And we'll be able to look at the clinical features of UTI so that you can be able to know when you went there, the two of you are whole, and the lady comes back with this, then you can be able to relate and you can be able to know what to do. Yeah, so that is that. We also have there are these we call them what, pads, tampons that ladies use. Okay, having to overstay with these sanitary towels. That's the one. Sanitary towels. Yes, yes. If you have to overstay with it, it is moist. Okay, bacteria love moisture. Okay, so and they also love blood. It's a good media of bleeding of microorganisms. So if you have to overstay with these things, pant liners, tampons, pads, yeah, it's like it is a bleeding ground for microorganisms. These microorganisms can get their way to the urethra and you get the infection. Yeah, we also have other causes like people with diabetes. They are more vulnerable to getting UTIs than the general population. Yeah, one of them, or one of the reasons being somebody with sugars. Yeah, the sugar levels are higher than normal. Bacteria love sugar, and remember we said a port of entry of these infections is hematogenous. Hematogenous means through the blood pathways. So when the blood is that sugary, microorganisms find a place to flourish. So you'll find people who have diabetes, they are more likely to suffer UTI than the other population. So those are some of the factors or some of the causes that we say can cause UTI. But before I forget, there is the holding. There are people who have the mama mboga habit. Mama mboga ni ile, nitaenda choo nikimaliza kuuza mboga, nitaenda choo nikifunga soko. That is wrong.
Nitaenda choo nikimaliza kufanya hii kazi naandika, nafanya.
Yes. O hata watu wa ofisi basi.
Watu wa ofisi waone.
Holding. Nitaenda nikimaliza, it's not right. Having to hold urine in the bladder for long entertains the flourishing of microorganisms.
They are growing there as I'm holding.
Yes. And of course, they will turn against you and give you infection. There is also another one, blockage. Anything that can block urine, yeah, such that it's blocking it inaistagnatisha kwa bladder, as in it stagnates in the bladder for long, or ina block itoki kwa, as in inafunga pathways za kutoka kwa kidney to the bladder. They can also cause urinary tract infection, because what are you doing? You are stagnating the urine there, giving time microorganisms to flourish. Okay, so that is to say somebody who has something like kidney stones na zimeanza kuteremka, maybe zishaingia hata kwa hiyo pipe inaitwa ureter, itazuia mkojo kupita. So what will happen, that retaining of urine up there will encourage infection even to the kidney, which is part of the UTI. Okay, if you have something like even constipation, yeah, like we said the other day here when we were discussing about hemorrhoids, constipation, apart from it giving you hemorrhoids, it can also give you UTI. Yeah, it may restrain the bladder from emptying, so mkojo kunakuwa na residue ya mkojo in the bladder, and it's retaining, and that over retaining is not good. It can give microorganism a chance to flourish. So we need to try and avoid all those. Or rather, those are what will cause urinary tract infections, among others.
So you said the transfer of bacteria from their home, if I may use that word, to a neighbor's home. That means the neighboring organ or the neighboring space that is not supposed to be there.
It's not supposed to be
Are there some vehicles that can transfer, as you said?
Yes, the vehicles, one of them is like during a sexual intercourse.
Yes.
That is one of them.
Yes.
But let me make it clear here. In addition to E. coli, there are also other bacteria.
Yeah.
It's not the only one. It's only that is a leading one. It's top in the list, but we have others. Yes, that's why we say a wet pad, a moist panty liner for long, it will be a bleeding ground. That's why we say that urine that is contained in the bladder for long, we also have bacteria that will flourish. So there are many bacteria, only that E. coli is one. But for the vehicle of taking it from behind to the in front, sexual activity is one, though even hygiene habit, though we shall come to that during prevention, can also be a vehicle. Because if you have to go passing out urine as a woman, and when you're wiping yourself forward instead of backwards, what are you doing? You're bringing this E. coli anteriorly or in front.
You're transferring it to in front.
Exactly. It will get into the urethra. It will give you this infection.
I think you've said you come back to that.
I'll come back to that.
Okay.
Yes.
Tuendelee.
Good.
Yeah.
All right. So that is what causes urinary tract infection. So the next question will be, okay, fine. So if that is that, if I go for honeymoon, then I need to know this, I need to do this, I need not to divorce immediately, I come back from the honeymoon.
Hakuna makosa.
What are these clinical features? What is these signs and symptoms will you have, so that you can be able to know that you have urinary tract infections? They are so typical and easy to understand and easy to feel. First and foremost, you start by having an increased urge. Yeah, you want to keep going to pass urine all the time. Okay, that is one. The frequency increases. Number two, the urgency increases. Urgency is you've rushed to the washroom before even you sit on that seat, it has already started coming. That's the urgency. So the urgency also increases. Okay. Number three, that urine start having a foul kind of smell. It's not the usual smell of urine. You start feeling it's like it's smelling bad. Yeah, that is also another sign you look at. Another sign or another symptom you will find, you will start having pain. It may come in the beginning of passing out urine, or when you finish, you feel the pain. Okay, at times you even feel a burning sensation. Yeah, and then from there you may have lower abdominal pains. You may feel pains on the lower abdomen, especially when it is cystitis. You may feel pain on the lower abdomen. So those are some of the signs. And in men, as much as you're saying it is not very common, they may also experience the same. Times they may get a funny discharge, mucoid discharge, unusual discharge, yeah, because of the same. But we are saying this is the symptoms that we have mentioned, they are cross-board. Everybody will experience that. And because we mentioned something like a girl child, how will you know a child has? Children will cry when they are passing urine. They will really scream. Even if bado ni watoto wa diaper, watalia sana, utaona kana jikunja na kulia, because there is that pain when passing out that urine. So the moment you get those, you need to rush to the hospital. UTI responds very well to treatment. You start taking medications today, within 12 to 48 hours, you've already started feeling the improvement, and it just goes away. But make sure you finish your dose. Yes.
You've talked about the diapers. So diapers are also another culprit in terms, probably if it stays for too long.
Yes, if it stays for too long, it can become a breeding ground for microorganisms that can further cause infection. So we always advise, once the diaper is wet, just change the baby.
Change the baby.
Yes. And if it is like they have poo-pooed on it, you need to be even more careful. We do not want the poo-poo to touch on the urethra. Yes.
Okay.
We do not, because that's how one of the ways that E. coli will get into the urethra. So even a girl child needs to, a baby girl, girl baby or baby girl needs to be wiped backward. Please never forward. Backward all the time.
And
so
I think that one, Daktari,
yes,
just look into the camera.
Yes.
Because we have house helps in our homes.
Yes.
And even as parents, we may not know that that is the way, that is one of the training or information that we need to share with our house helps.
Yes.
I know there are some situations where house helps are changed regularly. It happens.
Yes, sure.
Mwingine anakuambia, like one told me in the morning, I'm going home, and I'm actually preparing to go to work.
To go to work, sure.
You know what I did? I just left. I just decided, Sasa, I have set my mind, I'm going to work. I still found her in the evening, but during the day I looked for another one. So there is that change, and I believe there are some of our viewers who are watching us, and they're saying, yes, I've never trained my house help on this area. And then probably I find my child getting, those infections.
Yes.
Probably you could look into the camera and just talk to us.
Those who are still
as
having
mothers,
diaper babies.
As mothers, there are those that are, some of them are teenage mothers. They may not even have known all this. A baby just came and we don't even have somebody else to, So I think that information, I think, tell us.
Thank you so much, Jane, for insisting that I clarify on that point.
Yeah.
Yes, I would want to clarify onto that point because there are some things that you as a mother, you have to like pass this information to the caretaker or your house help so that she can be able to know. Possibly she doesn't know. Okay, they need to know whether it is a baby who is still using diaper, you have to always wipe backwards. Why? You do not want whatever you are using to wipe, whether it is a wipe, it is a napkin, whatever you are using, to be a vehicle to bring these bacteria from behind to in front. Let me use the simplest of the language.
Yeah.
Okay. So whether it is a boy or it's a baby girl, you have to always make sure you wipe backwards. Then the moment a child begins acclimatizing himself or herself to potty, start teaching that baby from the word go. That anytime after kupupu, you have to wipe. After kususu, you wipe going backwards and never in front. Remember some of these habits. Once you train a child, they'll keep doing them for the rest of their lives, even of the rest of their lives. And even when they go to school, they become teachers of the other children they find.
Yeah.
They find a child doing the other way and they tell them, no, mommy said we should do it this way. And your child becomes an advocate of good health.
Yeah.
So always, and even for women, wipe backwards.
Yes.
But before we finish this topic, for women, I'll talk to you as women. What should you do? There are 5 commandments that you have to follow to avoid UTI.
5 commandments.
Yes.
We are waiting.
All right.
We are waiting.
All
we are
right.
waiting.
Yes.
Let's go on.
Okay, so maybe from there, what I would want to say is maybe somebody may ask, why are women more vulnerable? Yes, the answer is not so simple, but I have it for you. The answer is basically on the way we are created. It's nature.
Yeah.
Yeah. There is a big difference between the way a woman is created and the way a man is created. One of them being this pipe we talked about, the urethra, the one that connects from the bladder. Bladder, remember, is the urine storage tank.
Yes.
To the outside.
Yes.
Men have a longer one as compared to women. That means the moment a bacteria comes at the door, yeah, where does it reach first? Of course, it will reach first to that person who has a short urethra, who happens to be a woman. That is nature, which we cannot do something about it. Okay? Yes. Number 2, still about nature. Men possess something we call a prostate, which women don't have. A prostate is known to produce or to secrete antiseptic secretions, which can be able to fight off microorganisms or even kill them. So women don't have. So the moment a bacteria gets into the urethra, it goes and stops to the bladder, and it starts causing havoc or causing infection. But in a man, there's a possibility it will encounter the prostatic secretions and it will be overwhelmed. So it becomes a protective mechanism to the men. So that is also another anatomical or another natural thing that we find ourselves being at risk, or women being at risk as compared to men. So those are the main ones that makes a woman, and also that nearness of the anal region and the urethra being very close, which is also a nature of women, makes it very easy for that bacteria to be carried from there, which you said is the main one, not the only one, the main one being carried from there to the urethra. Those are basically the main thing that make a woman to be more predisposed to UTI than a man. Yes.
So how common are the UTIs to us? As much as you've explained about how it comes, how frequent?
UTIs are very common. And in the beginning, I said 1 in 5 women will suffer UTI in their lives. Yes. That's a very, it's a big number.
Yes,
that is to mean number. At one point in time, a woman will remember I one time suffered this. Yes. And okay, I think maybe the other predisposition is a pregnant woman. A pregnant woman will also have higher chances of getting UTI than an unpregnant women. Why? Because of the relaxin hormone. You remember?
Yeah, I remember.
Said it another day.
I remember. Yes.
We said relaxin hormone will lower the speed of digestion. Yeah, because of the gut.
Yes.
It may relax beer. Okay. The same thing will relax the urinary tract. So you'll find urine is being retained in the bladder longer, which can entertain infection. Remember, we said we should not hold. Yeah, that bladder should not hold mpaka inaanza ku overflow because you are waiting to finish what you're doing. No. So women of pregnancy, which is also a women thing, also predisposes them through that direction. Because when there is that laxity of the organs, yeah, and bladder per se, there is over retention of urine there, which can predispose to growing of the bacteria and hence the infection.